My name's Martha Craig, and what happened to me was I sit down on the couch, put my leg under me, and something popped. The first meeting, he talked to me and they did some x-rays, to see just what it was, and then he came back in and told me that I had the tear and told me basically what he would do when he did the surgery, and we set up a date for the surgery.
So Martha came in complaining of right knee pain that had been going on for quite some time. She also had what she describes as a clicking or a catching, what I would call mechanical symptom whenever she walked, especially with pivoting, twisting, walking on uneven terrain. It felt like something inside her knee was catching. Her physical exam was concerning for a tear of the structure called the meniscus. Her x-rays looked great. I mean, chronologically she's in her mid-60s, but her x-rays looked like someone far, far younger. She had really no significant arthritic change on her x-rays. So we got an MRI of her knee, which did show a tear of the medial meniscus. And so what is that? That's a structure inside the knee. If we look at a model of the knee's made up of the femur, the thigh bone, the tibia, the shin bone. If we move the kneecap out of the way, between those two bones you have two semicircular structures, C-shaped structures. The one on the inside is called the medial meniscus. On the outside of the knee is the lateral meniscus. And they're shock absorbers. And so as we get older, the collagen inside the meniscus, the collagen bundles get disorganized, and it's easy to tear, and it's very, very common. And so she had a tear of the medial meniscus, and so we discussed treatment options. She had really maximized non-operative management at that point.
I liked him from the minute he walked in the room. He was very personable, and he, when you talked to him, you didn't feel like you were talking at him. You knew you were talking to him, and he was listening. Surgery went fine. I now can't even tell that I ever had surgery. I can even sit on that leg with that leg up under me again, but I try not to do it too often. Yeah, it went great. It's just fine.
And so we had a patient with chronic knee pain, mechanical symptoms, and although she's in her 60s, she had essentially normal radiographs. And so we discussed surgical intervention at this point, which was called an arthroscopy. And so basically in that procedure, we make two small poke holes in the front of the knee. And we introduce a camera into the knee joint with instrumentation, and we go in and we basically clean out the torn tissue that's not functional, that's causing the mechanical symptoms and pain. It is an outpatient surgery, meaning the patients go home the same day. It takes about 20 minutes. The patients are on crutches for just a few days after that, but they can come off the crutches as tolerated, meaning as their symptoms allow. They're going to be sore for a few days, but that usually quickly subsides. We do get you into physical therapy. It's not an extensive amount, but some to work on your range of motion and strengthening. The vast majority you'll do on your own. And it's really a matter of just a few weeks until you're completely over the surgery. It's very, very effective, and I know Martha has been very, very pleased with her outcome.